Okay.
Hi, can I come in?
Yeah.
Hi, my name is Mallory. I'm going to be your student nurse today.
Hi.
Can I please verify your first and last name and date of birth?
Yeah, Millie Larson, 12/14/1949.
Okay. Hi, Miss Millie. Can I please check that on your wristband? Perfect. Do you have any known allergies, Miss Larson?
No.
No? Okay, let me verify this information on your chart. Okay, perfect. Everything's matching up. Let me go ahead and get some gloves. And what brings you in today, Miss Larson?
I rolled my ankle while gardening yesterday.
Oh no, I'm so sorry to hear. Can you describe that pain for me, please?
It's kind of like throbbing and burning.
Throbbing and burning. Can you point to where it hurts on your ankle?
Right here.
Okay, on your right ankle. Does it spread to any other parts of your body?
No.
No? Have you done anything to alleviate the pain?
No.
No? Okay, and when did this happen?
Yesterday.
Yesterday? Okay. If you can rate your pain on a scale of 0 through 10, with 0 being no pain and 10 being the worst pain you've ever felt, how would you rate your pain?
I would say it's a 3 out of 10.
3 out of 10? Okay. Do you have a goal for your pain today?
I'd like to be a 1 or 2.
1 or 2? All right. We'll definitely work with the doctor to get your pain down to a 1 or 2. I'm going to move into the head to toe assessment of your appointment today. It's going to take about 15 minutes. Is that okay?
Yeah.
Okay, perfect. Before we get started, I want to ask a few more questions. Do you know where you're at right now?
I'm at Concordia Hospital.
Concordia Hospital. And do you know who the President of the United States is?
Biden.
And do you know what day of the week it is?
Monday.
Okay, so you are alert and oriented ×4. Your speech is steady and stable, and you are conscious and alert. So now I'm going to move in and start inspecting your scalp. All right, hair is evenly distributed. There's no signs of pressure ulcers on the back of your head or on your coccyx. Perfect. Your temperature is warm and skin color is appropriate for ethnicity. I'm going to check your temporal pulses, which are +2, equal bilaterally and regular. Now I'm going to move in checking your eyes. Okay, your conjunctiva is pink and moist. Your sclera is white. No signs of jaundice or pus or drainage noted. I'm going to go ahead and start inspecting your nose now. Can you go ahead and look up for me, please? Perfect. Skin is intact. No signs of excess drainage. I'm going to check your ears. Right ear skin is intact with no excess cerumen. Left ear skin's intact, no signs of excess cerumen. Perfect. Now go ahead and open your mouth for me, please, and stick your tongue out. Say ah. Okay, perfect. Tongue is pink and moist. Mucous membranes are pink and moist. No signs of oral thrush were noted. And Miss Millie, do you wear any dentures?
No.
No dentures. Do you use any hearing aids?
No.
Okay, and do you use contacts or glasses?
Mm-mm.
No? Okay, perfect. And there's no signs of, you don't have any loose teeth, do
No.
you? Okay, sounds good. So now I'm gonna go ahead and check your 6 cardinal fields of gaze. Just go ahead and look at the top of my pen for me, please. And now in and out, perfect. Okay, and I'm gonna shine a light in your eye. Just look at the back of the cabinet, please. Okay, pupils are equal, round, restricted to light, and accommodating, and they are about 3 millimeters. Okay, perfect. So now I'm gonna give you a little pinch to check for dehydration. Okay, you're nice and hydrated. No signs of trigger noted. Do you have any difficulty swallowing, Miss Larson?
No.
Okay, I'm gonna check. Just go ahead and swallow for me, please. Okay, no signs of tracheal deviation noted. Now I'm gonna check your carotid pulses, 1 on each side. Okay, carotid pulses are +2, equal bilaterally and regular. Now I'm gonna run my fingers down your arms. Did you feel my fingers? Okay, perfect. So sensations present in the upper extremities. I'm gonna check your brachial pulses, which are +2, equal bilaterally and regular. Now I'm gonna check your radial pulses, which are +2, equal bilaterally and regular. And while I'm here with your arms, I'm gonna check your arms I'm going to check the muscular integrity of your arms. Go ahead and raise your arms up for me, please. Move them in a nice circle. Okay, circumduction's present. Now go ahead and extend your arms forward. Perfect. Bring them back for me, please. Perfect. And lift them all the way up. No signs of pressure ulcers noted. Okay, perfect. You have full range of motion in your upper extremities. Now let's check your strength. So go ahead and push against my hands. Perfect. Pull against them. Okay, and squeeze my fingers. Okay, you have 5 out of 5 strength in your upper extremities. Now I'm gonna move into the chest, okay? So upon inspection, the chest is symmetrical. I'm gonna start checking for lung sounds, 6 in the front and 8 on the back, okay? I'm gonna guide you through it, and if at any point you start to feel dizzy, please just let me know. In, out, in, out, good. Out, good. In, out, good. In, out, good. In, out, good. Okay, lungs are clear to auscultate bilaterally on the anterior aspect. Let's check your back now. In, out, good. In, out, great. In, out, great. In, out, in, out, in, out, in, out. Lungs are clear to auscultate bilaterally on the posterior aspect. I'm going to move into heart sounds. I'm going to stop for 60 seconds to check your apical pulse, and then I'm going to stop for another 30 seconds to check for respirations, okay? S1, S2 present. Now I'm going to stop here in between the 4th and 5th intercostal space of the midclavicular line to check the apical pulse. Okay, your heart rate was 89 beats per minute and respirations are 14 breaths per minute. And upon inhalation and expiration, chest expansion is symmetrical. Now I'm going to check, since I'm working on respiratory, I'm going to check the capillary refill. Your fingers. Which is less than 3 on all 10 digits. Perfect. Okay, so now I'm gonna start asking some questions about your diet and food intake because we're moving into the GI portion of your assessment. How would you describe your diet at home?
I usually eat 2 to 3 meals a day, and I usually eat like a sandwich or some rice and chicken. Sometimes I'll have oatmeal in the morning.
Okay, so it looks like you're getting your whole grains and you're eating protein too. Just try to hit all 3 meals of the day. We want to make sure that you're consuming as much nutrients as your body needs. And how much water do you drink a day?
I would say like 3 cups of water.
3 cups of water? Okay, try to get to 8 ounces at least a day. If you don't like the taste of water, I recommend trying some Crystal Light in the water. And do you feel like the amount that you're urinating is proportionate to how much fluid you're intaking?
Mm-hmm.
Okay, great. And do you notice any strange odor in your urine?
No.
Does it hurt while urinating?
No.
Do you have a hard time making it to the bathroom?
No.
No? Okay, great. When was the last bowel movement you had?
Yesterday.
Yesterday? Okay, and can you describe your bowel movements for me, please?
It was soft and brown.
Soft and brown? Okay, perfect. That's what we love to hear. So now I'm gonna have you lay back for me, please. One more question. How often do you pass bowel movements?
I would say every other day.
Every other day? Okay, great. And I also forgot one question earlier. Do you cough up any sputum, or do you have a cough?
No.
No? Okay, great. So now I'm gonna start inspecting your abdomen. I'm gonna pull up your shirt first. There's no signs of distension upon inspection. And now I'm gonna start with auscultating at the right lower quadrant. I'm gonna work around clockwise. Okay, bowel sounds are present in all 4 quadrants, and skin is dry, and color is appropriate. Your skin color is appropriate for ethnicity. I'm gonna start with palpations. If at any point this is uncomfortable, please just let me know, okay? I'm gonna start with light palpations. 1 to 2 centimeters deep. Okay, no signs of hernias, masses, or abdominal obstructions noted upon light palpations. I'm gonna move in with deeper palpations now, 4 to 8 centimeters deep. Again, if this hurts, just let me know. Okay, no signs of hernias, masses, or abdominal obstructions noted. I'm going to check your bladder for distension. Okay, bladder is not distended. All right, I'm going to help you back up now. Okay, perfect. We're not going to check your femoral pulses, but I'm going to check your popliteal pulses. They might be faint, which they are. So I'm going to check your dorsalis pedis pulses now, which are +2 equal bilaterally and regular. And your post-tibial pulses are also +2 equal bilaterally and regular. I'm gonna run my fingers down your lower extremities. Are you able to feel this sensation? Okay, perfect. Sensations present in lower extremities. And now I'm gonna check for edema. No edema noted, no pitting edema. Okay, 0 on edema, no edema noted. Now I'm going to check for ulcers on your heels. No pressure ulcers, no pressure ulcers. I'm going to now also check actually let's do this first. I'm going to check let's do capillary reflux first. Okay, perfect. Okay, capillary reflux is less than 3 on all 10 digits. That's great. I'm gonna change my gloves and sanitize my hands. Okay, so now we're gonna move into solely the musculoskeletal portion of your assessment. I'm gonna help you off the chair. But first, let me just check one movement in your legs. Okay, can you go ahead and push your legs up for me? Pull them up. Okay, perfect. Now I'm gonna check for your feet. Go ahead and pull down like a gas pedal. Perfect, and then push up. Okay, great. So 5 out of 5 strengths are in your lower extremities. Let's help you off the table now. Okay, and now we're gonna check your gait. Go ahead and walk to that door for me and back. Perfect. Your gait is steady and stable. There's slight guarding due to that injury in your right ankle, but that's expected. Now we're gonna go ahead and check some leg swings. Check if you're able to do leg swings. So go ahead and hold on to this. Perfect. And then go ahead and kick forward. And now back. Okay, great. And now forward. And now back. Okay, perfect. You have full range of motion in your lower extremities as well. That is good to know. I'm sorry if that hurt your ankle a little bit. The doctor did go ahead and prescribe 400 milligrams of ibuprofen every 6 hours as needed for your pain. We want to make sure that you rest and elevate your ankle and that you apply ice at least 3 times a day for 20 minutes. And we have a follow-up appointment with you in 2 weeks. So this concludes our appointment today. Do you have any questions for us, Ms. Larson? No? Okay, well, it was great to meet you. I hope you feel better.
Thank you.
You're welcome.